Hi, this is Dr. Donald Pelto. I'm with Central Massachusetts Podiatry, and I'm very excited today because I've put together this healthcare guide to diabetes in your feet. And I want to give it to you because I offer it to my patients. If you're like a lot of people that I know, you look on the internet, you look all around, and you're not able to find credible information, helpful information about diabetes in your feet. And that's why I put this together. Now, all I would ask is you put your email and your name on the side, and I'm going to send you this book. It's filled with information that I've put together through my experience of 4 years of college, 4 years of podiatry school, and 3 years of a surgical residency, where a bulk of my work was working with people with diabetes and doing all that foot surgery for diabetes. Now, I'm not saying that you're going to need foot surgery, but I'm here to try to prevent it. And what you're going to find in this book are 3 ways to prevent a foot wound. Did you know that most problems like amputations start with a foot wound? Pretty much every wound begins and then it leads to an amputation. You don't just get an amputation or these complications due to diabetes. I want to show you what the 3 ways to prevent a wound are. I also want to show you the 8 steps to do a comprehensive foot exam. Now, what exactly is a comprehensive foot exam? You may think, well, my primary care doctor looks at my feet, or I look at my own feet. What are you looking at differently? Well, let me ask you, do you ever see an eye doctor? You do. It's because they look at your eyes in a different way than your primary care physician or your internist. And it's the same way with us. As a podiatrist, we look at your feet in a different way. We look at these 8 different steps to look at a comprehensive diabetic foot exam. And I want to go through and teach you what those are. You can even do it on yourself. I'm going to tell you 4 questions that you should ask your podiatrist. As well, in this book, I want to go over the 4 serious foot care mistakes that people make. Let me tell you some important tips. The first tip, I don't want you ever to trim your own calluses. You may have a callus in the bottom of your foot. You may have a callus between your toes, on the top of your toes. Don't trim them and don't have anyone else trim them. If you're going to see a pedicurist or someone to trim your nails, you shouldn't have them trim it. You have to be very, very careful because it can cause a foot wound. A wound starts, it could get infected, and then it could lead to other problems. The other thing that I see a lot of people with diabetes do is they have ingrown toenails on their feet. It's painful, it's red, or even worse yet, if you have neuropathy or lack of feeling in your feet, you may not know that you have an ingrown toenail. And you try to trim it out and you get a portion of it, but you leave a little bit in the edge. If you leave that, that can get infected and lead to a problem. Worse yet, if you have poor blood flow or poor circulation, you may not be able to heal that infection. But the third tip is be careful with your shoes. You may say, well, I've always been a size 6. I've been a size 6 since I was 18 and I'm still a size 6. Well, you know what? As you get older, as you have children, your foot size probably doesn't stay the same. You should be measured. And when you get new shoes, if you have any redness, any blisters, any rubbing, you should throw those shoes out or bring them back. Always wear your shoes at home. You shouldn't have to break in your shoes when you have diabetes. There's no such thing as breaking them in. Because if you break them in, they're going to break you in and cause a foot wound on your foot. Be very, very careful. Now, if you don't know this, there's a little tip. Most insurances, including Medicare, they cover a free pair of shoes. Now you may wonder, the government doesn't give me anything for free. Why are they giving me a free pair of shoes? Well, it's because they found if they give out 300 pairs of shoes and prevent 1 wound or 1 amputation, they've made their money back. So that's a question you should ask your podiatrist. How do I get a pair of diabetic shoes? And the last tip, I want you to be very careful. Okay? This is very serious. You may not have any pain if you have a foot problem. You may have neuropathy or poor feeling in your feet. You may have a foot problem and not know it. That's why if I can give you one tip as we finish here, that's going to help you prevent a wound, prevent an amputation, prevent any other type of foot problem, it's this. Look at your feet every day. I know it sounds very simple. It's easy, but so many people don't do it. People get busy. They can't flex down there. They can't look at them. If you can't look in the bottom, get a mirror. Ask a loved one to take a look at the bottom of your feet. Because by looking at your feet, looking at any changes in your feet, is the most important thing that you can do to prevent a foot wound. So I hope you put your name and your email on the side, and I really hope you'll enjoy this healthcare guide to diabetes in your feet.